Hello, I am Dr. Ashley Prosper of UCLA Radiology, Chief of Cardiothoracic Imaging, and co-director of UCLA's lung screening program. I would like to share 5 things that I would like you to know about lung screening with low-dose CT of the chest. Number 1, lung screening with low-dose CT of the chest saves lives. You might wonder how I know this. Well, a large randomized clinical trial, including over 53,000 participants, was led by UCLA's own Dr. Denise Aberle. This trial showed us that when smokers were screened with low-dose CT of the chest, they received a 20% reduction in the risk of dying from lung cancer as compared to those who were screened with chest X-ray. This is a sizable benefit. Number 2, as this is a very effective test, you might wonder who qualifies for lung screening with low-dose CT. Well, this exam is designed for those who are high risk, current and former smokers. What do I mean by that? Well, you should be at least 50 years of age. You need to have smoked at least a 20 pack year smoking history. You might wonder, what is a pack year? Well, to calculate your pack years, we take the number of packs of cigarettes that you've smoked per day, and we multiply it by the number of years that you've smoked. For example, if you've smoked 1 pack of cigarettes per day for the last 20 years, that is a 20 pack year smoking history. Alternatively, if you've smoked 2 packs per day for the last 10 years, that is also a 20 pack year smoking history. The last requirement is that you need to either be a current smoker, or if you've stopped smoking, you need to have quit within the last 15 years. Next, let's say that you qualify and you're interested. You might wonder, how long is this exam going to take? Well, I'm happy to share that it's a very quick exam. Once you are scheduled for the CT and positioned in the CT scanner, we will ask you to hold your breath for just a few seconds while we take images, and then we're done. So, after we've taken the images, what happens next? A radiologist, such as myself or one of my colleagues, will review those images and prepare a report both for you and for your doctor. Last thing you might ask is, how often do I have to do this exam? Is it just a one and done? Well, it turns out that screening with low-dose CT is most effective when you both follow up with your doctor afterwards and return annually as long as you're eligible for this exam. Thank you so much for allowing me to share these 5 facts about screening with low-dose CT of the chest. Thank you.